Hi, this is Dr. Joe Niamtu, LoveThatFace.com, and we're going to talk about lip reduction today. This is a relatively common procedure we do, and we do this from people all around the country. I use lasers here. We're making an incision with a laser, and there's one thing that's very notable, and that is there is not any bleeding. So the lip is a very vascular structure, and anybody that's ever bit their lip or cut their lip knows that it can bleed profusely. But you can see when we're using the luminous CO2 laser, there is just zero bleeding. So what we're doing is removing a precisely determined amount of mucosa, or the moist red part of the lip that is inside the mouth. Our goal is to make our incision so that it is hidden when the lip rolls back. Again, if this is done without a laser, it's a very bloody procedure, and more blood equals more pain, more bruising, and longer healing. So what we're doing is removing this strip of mucosa, and in a lot of respects, this is very similar to doing eyelid surgery, and this would be analogous to removing the skin. So the tissue under the mucosa is the submucosa, which consists of salivary glands, fat, and then there is muscle under that. So we'll take off this. The procedure takes about 15 minutes to do per lip. It's a little faster when you're using a laser because you don't have to deal with stopping the bleeding. So that's what the underside of the lip looks like, and here's our specimen excised from the lip. Now, depending on what we're doing, frequently we'll take out a small wedge of tissue so we can reduce the internal thickness of the lip, where we not only want to make the lip smaller, but we want to make it less bulky. And by taking out a little wedge here and making a little trough, we're able to roll the lip back on itself, and the patient will show less lip, but also have a less bulky lip. Now, not everyone needs this tissue removed. It really depends on the size of the lip and what we're trying to achieve. The next step is to achieve and maintain symmetry. We're using gut sutures, so these sutures will dissolve, and we're putting these relatively equal spaced, and these sutures will bear tension. As the final sutures, we want them tension free so we won't have any scar problems. This incision is engineered to lie within the mouth, so at first you see the stitch line, but after the lip swelling goes down, you won't see it. So here's the finished procedure, and there's the mucosa that we removed, so we shorten that lip significantly, and again, when the swelling goes down, that lip will roll back. So that's how we do a lip lift. We leave these stitches in for about 8 days. This is Dr. Joe Niamtu, LoveThatFace.com. Thank you very much for watching this video.